When patients come in for a facelift consult, they often say, hey, what is a facelift? And in my mind, I try to break it down. There's actually, in my head, 4 different regions of the face that we can lift. We can lift your brow, we can lift your cheek, we can lift your jowl, and we can lift your neck. And it's very important to define what does a facelift mean to the patient, which of these, or maybe it's all of these areas that they want lifted. And of course, on top of that, we have the eyes, which is in the middle of it all. So often we will do a procedure on the eyes and then lift one or more portions of the face. Each of those areas of the face, though, age differently. They age at different times and they age in different ways. And that's why you have to be able to customize a facelift based on what sort of aging that you see. For example, the cheeks are probably the first thing that fall. We generally see this in women around their 40s. The cheeks start to drop. We start to see the nasolabial fold get deeper. The corners of the mouth come down. And more importantly, this prominence right here, which gave nice cheeks and a nice youthful look, tends to start flattening and heading south, eventually becoming a jowl. So often this is the first time people start talking about a facelift. As well, right around this time, the brows start to drop. We start to see the brows coming down, heaviness on the upper eyelids, and sometimes asymmetrically. You know, one brow will drop, unfortunately, before the second brow drops, so that puts another dimension into the problem. Jowling, which is where some of this tissue falls below the jawline and you start getting the hang like grandma had. That certainly is something that we see as well too. And finally, the neck is actually a threefold problem. You can have extra skin, you can have extra fat, or you can have muscles that just kind of pop out and create some of those turkey gobbler lines. So all facelifts are not so simple, and we assess every patient and we see what's going on. I also tell patients that there's actually 2 ways you age. You age by things dropping toward the ground or gravity, but people also age by deflating. And when you deflate, surgery is not the answer to that. And more importantly, when things fall toward the ground, fillers are not the answer to that. So you have to actually come up with a game plan of not just lifting. Perhaps we need volumization. And this is something that we have to look at when we're doing the consultation. Often I see dermatologists fixing everything with syringes of filler. Sometimes I see surgeons fixing everything by pulling it up as tight as they can, and neither one produces a natural, good-looking result. We try to understand what is what and try to come up with a game plan that addresses all aspects of aging.